Oral chelation and EDTA.
Yeah, and you just wait until you hear the success stories we've had with that.
Incredible success stories for over 20 years, huh?
Yeah, nearly 40 now.
40 years. Heart disease remains the major cause of health complications and death in spite of all the advancements in science. One of the lesser talked about methods for both preventing and possibly managing safely is chelation. Tell us a little bit about chelation and your experience with it.
The word chelation means to bind or bring together. So, for example, when we create a calcium supplement, we bind it with acids, amino acids, citric acid, malic acid. Why? Because it enhances the absorption in the stomach. Well, we can use the same concept of binding to take things out of the body. For example, heavy metals, calcium ions that are sticking to your artery walls where you don't want them to be. Mm-hmm. And we can do so relatively effectively and with virtually no side effects whatsoever, providing obviously that it is done correctly. Chelation has been used for at least 40 years. It has evolved like many other things in medicine and science, and today it is near perfect in its administration and application.
And what's the difference between oral chelation and intravenous?
Well, both use artificial or synthetic amino acids, and the main one that we use is EDTA. And that is a synthetic amino acid, which is what makes it work, by the way, because it can't be broken down in the body because the body doesn't recognize it.
And what does EDTA stand for?
A very big, long word.
Oh, okay. All right.
That no one would remember past 5 minutes from now.
All right.
But both EDTA can work intravenously and orally. Intravenous chelation is more aggressive. Because obviously when you're infusing something into your bloodstream directly, you're getting a higher dose, you're getting greater potency, you're getting volume, and that produces a shorter and more effective response.
Yeah.
Oral chelation is not less effective, but it takes longer. So the duration of time to get the ultimate benefit is considerably longer. However, both of them have pros and cons. Intravenous chelation is very expensive. You're looking at $4,000 to $6,000 plus for a series of treatments. Plus, which you have to travel to an intravenous chelation center in order to get. So unless you live in the neighborhood, you've got travel and hotel and a host of other experiences. Now, if you're in an acute situation where you have a major arterial blockage, obviously intravenous chelation and those issues would be worth it.
Yeah.
But for most people who can practice some prevention, get things under control before they get too severe, oral chelation is ideal. It can be done at home. It's relatively inexpensive. You do have to do it for a minimum of 6 months or longer because it works slower. But you don't have to travel. You can do it in the comfort of your own home by taking some capsules.
And these are all the reasons why you prefer oral chelation over intravenous.
Yes, simply because of the cost factor and of the convenience, mostly. And again, if you have a very acute situation, an initial series of intravenous chelation treatments might be necessary up front, and then follow it up with the oral chelate afterwards.
And what makes up an ideal oral chelation formula?
Well, one of the drawbacks to chelation therapy is that it is not selective with the minerals that it chelates. So not only is it going to chelate and remove calcium ions from your arteries, it's also going to remove other potentially beneficial minerals, which can create electrolyte imbalances and a host of other things. People get leg cramps from a lack of magnesium and so forth. The advantage of oral chelates is that we can put those minerals in the oral chelation formula, so you never are in a position of deficit.
Okay. So you're taking out the bad and putting in the good that was removed by taking out some of the bad.
Yes, because you can't be 100% selective.
And so what are just a handful of the ones that really stand out to you of the success stories that you've had with your oral chelation formula?
Well, I most recently, we had clients come to us, and the husband had 70% plus blockage in two major arteries.
Wow.
And the doctor wasn't horribly concerned. I don't know why, but he wasn't. And he said, well, we're going to just watch it. And I said, so they called, and I said, well, while we're watching it, why don't we do something proactive about it? And we started him on the oral chelate formula. And basically, in 6 months, he went back to his doctor, and the doctor said that the blockage had been significantly reduced, and he saw no need for further intervention.
Man, that's just beautiful. And everything should always be, decided by your doctor. And to find out what your doctor thinks is best for you, they should always do that. But in something that simple, it's so beneficial. And it's
here's the deal. If you took this oral chelation or oral chelation formula every day as a multivitamin the rest of your life, it wouldn't do you any harm at all.
Oh.
So in other words, there's no risk, there's no side effects to an oral formula whatsoever.
Yeah. And that example that you're giving, that one example, that definitely they had to be on it 6 months or more.
Well, was considerable improvement after 6 months. However, I suggested that they stay on it indefinitely because they do have a genetic high risk for heart disease in the family bloodline. And so to this day, they are still taking it as a regular supplement.
And with great results like that, why would you not, right?
Well, yeah, especially with zero side effects involved.
Yeah, there's no reason. The latest thing is berberine and weight loss.
Well, berberine, of course, like the latest craze, is not the whole story, folks. There are many other nutrients that need and should be included to make it more effective.
And so berberine is in the news, and they're discussing berberine like it's the next, or it's the natural Ozempic. What are your thoughts? And there's a lot of other, berberine's been in the news for other things, but what are your thoughts specifically on berberine being called the natural Ozempic? Do you think that's a little reckless, or do you think it's warranted?
Well, I think it's probably at least in part accurate. However, it places berberine, which is a natural herbal extract, in the same potential class of misuse as Ozempic.
Oh, yeah.
Keep in mind that Ozempic and its relatives is really designed for hypoglycemia, insulin resistance, and type 2 diabetes.
And the main one, type 2 diabetes.
And mainly type 2 diabetes. Because of its ability to regulate insulin production.
Yeah.
And when we start using these things for purposes other than they were intended, there can be issues. And as we are now discovering, the issues connected with things like Ozempic and probably eventually berberine can be significant. Significant gastrointestinal distress, which oftentimes persists after the person stops taking these things. And what the manufacturers of these drugs don't tell you is that in order to maintain the benefit of weight loss, you have to take it indefinitely.
Yeah.
And that can present a problem with people with normal insulin levels because it's driving your insulin levels too low.
What is the other benefits and risks associated with natural berberine?
Well, again, everything is dose specific. If you take 2 aspirin for a headache, you're good. You take 12 aspirin for a headache, you may not be so happy. And so everything is dose specific. And it's the same with herbal extracts. Berberine is a natural herbal extract. If a little's good, very rarely more will be better. And berberine is very difficult on the digestive system for many people. And I always suggest that when you choose to use it, then I would recommend starting out with a very low dose, taking it with a meal to help prevent gastrointestinal disturbance. But you see, people, especially people who are doing things to lose weight, there is no greater class of desperate human beings on earth than people who want to lose weight.
Yeah.
But they want it now. The fact that they've been overweight for 20 years doesn't concern them. Now, they want it tomorrow. Yeah. They want to be trim and their ideal weight tomorrow.
And they want to do it in a week.
Yeah, and that doesn't happen, folks. It doesn't even happen in a few months most of the time.
Yeah.
But what happens
it took me 9 months to lose 60 pounds.
But you did it right.
Yeah.
And as a consequence, you never gained it back.
No, yeah.
Now, you're still at the same ideal weight you were years and years ago.
Yeah.
And that's the difference between doing it right and not doing it right. And one of the ways that you cannot do it right is to take these substances, including berberine, in excessively high doses and thinking that, wow, this is just going to peel this weight off of me. And it's true, it helps. But it helps by specifically addressing insulin levels. And if you're not diabetic or hypoglycemic, your insulin levels might be elevated, but they're probably not elevated excessively. And by taking high amounts of these things, including berberine, you may be driving your insulin levels too low. And you're putting your digestive system at risk at every level, stomach, intestines, colon. So if you choose to use this, I'd start out with 100 milligrams, not 500.
Yeah.
And that's what everybody said. Take 500 milligrams 3 times a day. Well, you may pay dearly for that, and you may not. Yeah. It depends on your system.
Well, because everyone's different.
But why not start out with 100 or 200 milligrams once a day, see how your body tolerates it, and then add some more until you find a safe threshold. But just because something is natural versus drug doesn't make it 100% safe in all cases. You can OD on natural substances.
Yeah, well, I mean, you can OD on water.
Yeah, believe me, I've talked about that many times. Everybody's preaching about dehydration and lack of water, and it's true. A great many people do suffer from dehydration because they don't drink enough water or get enough fluids, not just water. But you can OD on water and so deplete your electrolytes that you go into cardiac arrest. So again, if a little's good, more is not necessarily better.
So let's say somebody doesn't want to do the Ozempic. They talk to their doctor. They go, the doctor, whatever they decide on. But they want to try to do the berberine. What other, and they go to their doctor and they tell them, hey, I'm thinking about taking this supplement and it's called berberine. What would a good direction of cofactors, what are the cofactors needed to help the absorption and efficiency of berberine?
Well, trace minerals such as chromium, vanadium, the amino acid aspartic acid would be something I would put into a berberine complex formula. because they not only are going to accelerate your response, but they're also going to help mitigate some of the potential side effects of elevated excessive berberine consumption.
And so the only product that has berberine in it from Phoenix Nutritionals at phoenixvitamins.com is the blood sugar support, and that's because of what it does and what it's for. So there is berberine in the blood sugar support at
but a host of other things as well.
All the correct cofactors.
Which is going to help the body utilize berberine better and get a better benefit from it without having to take excessively high amounts.
Yeah, well, I think that's a good foundation for people who are thinking about talking to their doctor about berberine, or even the more fear and dreaded one of Ozempic, But I think that educating people about the natural ways, I think, is always kind of a good thing. I mean, some of the headlines are a little bit much, I think, but I think a natural way to go is, in my mind, always better.
Well, of course it is. But I just want to leave this discussion with making you aware that just because something is all natural doesn't mean it cannot have potential side effects if abused. So it's always use and abuse, and everything is dose specific.
Yeah. Well, there you go. That's the natural scoop on berberine. May is Anxiety Awareness Month.
Which, by the way, is exactly the reason I created my maximum stress support from phoenixvitamins.com.
Yeah.
It's a fantastic way to address your central nervous system and anxiety thereof.
And I just think it's funny that there's only 1 month, considering, how many people and how many kids are all on these antidepressants and all this stuff. I think it should be anti-anxiety. I think it should just be anxiety year.
Exactly. It is the most epidemic problem. And it's virtually all human-made.
Yeah.
We have created a life and a lifestyle that is so incredibly unnatural to our natural rhythm of way of living that virtually everyone at all ages suffers from some form of anxiety.
Yeah. And it's so universal. What do you think is causing this? The unnatural way we live, the 9 to 5, the not enough time with the kids, the not enough quality time with the loved ones because of the work and the daily grind and the jobs. Talk about the different approaches, like maximum stress support from phoenixvitamins.com and or the drug approach.
Well, again, anti-anxiety medications are the number one prescribed medications worldwide, but especially here in the U.S.
Yeah.
Now, there are several reasons. You can't burn the candle at both ends forever. You can't run on no sleep. You can't work 2 jobs. You can't try to raise a family. You can't try to manage a household. You just can't. And nowadays, it is impossible. It's virtually impossible to do those things without a 2-person income because of the way the cost of things is. So that means both parents are gone, oftentimes on different schedules, and that leaves children unattended or attended by someone other than a parent, and that can create anxiety in even small children. So medicine's response, and oftentimes necessary response, is the use of anti-anxiety medications, and there are several groups of those. There are SSRIs, which are antidepressants, and they can have some effect on anxiety, but the most direct group of drugs directly addressing anxiety itself are the benzodiazepines. Those would include Xanax, Valium, and a few others. And they're extremely effective. However, as I have often said on many subjects, there's a price to pay for success. There's a price to pay for that benefit. They work like a charm, almost with the first one you take.
Yeah.
But they're highly addictive, highly habit forming. And because of that, if you have to take them for any length of time in any significant dose, you may find when you're ready to get rid of those things because you're doing so much better, you may find it extremely difficult to stop taking them because of what's called the rebound effect from your central nervous system.
Yeah.
And so, should those drugs be used? Absolutely. I mean, if you're on the verge of going completely mad with anxiety and stress, you need something aggressive to sort you out, at least for the short term. But the goal should be to take them as infrequently as possible for the shortest period of time. Then we begin to look at natural.
Well, let's switch gears totally and talk about what makes up an ideal stress formula.
Well, first and foremost, we would use high amounts of the B complex, especially B6, B2, and B12. B12
such a
is
simple
the nerve
such
vitamin.
simple advice.
Well, yeah, and then when you combine that with herbal extracts such as kava, valerian, and those types of things, magnolia, you can get a pretty good natural anti-anxiety formula. And the good thing about that, because all of the things that are included in a good formula such as that are water soluble, which means that it's almost impossible to overdose on them. It is possible, because it's possible to take too much of anything, but it's difficult because they're water soluble and they flush out of the body in a relatively short period of time, usually 48 hours or so. And which is, on the other flip side, why we tell people to always take your supplements regularly, not just when you remember, not just some weird thing you read on the internet, heaven forbid. Take it every other day. Take it once a week. Here's the deal, folks. When you start taking a supplement program and you take that your supplement with your breakfast, that's going to be gone in 2 or 3 days maximum, maybe as soon as 24 hours.
Yeah.
So why would you take it once or twice a week? Then you've got all of that time in between where your body does not have access to those essential nutrients, and you ride yourself a roller coaster. High nutrients, no nutrients. High nutrients, no nutrients. And what do you think that does to your body chemistry? Oh, it's not always happy.
Yeah.
So, and it's a funny thing
You got to
that
be
I've
consistent.
noticed.
You got to be consistent.
Well, and I've noticed a funny thing about human nature. If your doctor recommends a drug to you, 9 times out of 10, you're going to take it exactly as it says on the bottle. For several reasons.
Well, because you want to listen to his advice.
Well, but not only that, but you want to get results.
Yeah.
From whatever you're taking it for. Secondly, because what you're often taking these things for is to management, treatment, or prevention of some disease. And you're afraid not to take it. But funny enough, you recommend to that same person to take for an example, in this case, a really good high-potency stress support formula, and all of a sudden, they'll take it once or twice a week because they treat it differently because it's not a drug from their doctor. What they don't realize is it oftentimes is more effective or as effective and a whole lot safer. And so it should be treated just like you're taking your medication. Take it as recommended.
Yeah. So all the other things people can do to manage stress, obviously spend more time with loved ones, pet your dog for the oxytocin, spend more time in nature, walk barefoot, all those things, meditation, prayer, all those things are always at top of mind and top of list. But if you do feel like you want to take a natural approach and you've talked to your doctor about stress supportive nutrients and your doctor thinks it's okay, a great place to look at is on phoenixvitamins.com at the maximum stress support. You can always start with just one bottle. You probably wouldn't recommend just getting one bottle because you like to see especially if someone's been nutrient depleted for so long, you would always say to do a couple months or, at least 3 months and 4 months.
Yeah, you have to remember that nutrients don't work like drugs.
Yeah.
Because drugs override the natural system. Nutrients support the natural functions of your body chemistry. And I always tell people, you need to take whatever you're taking and whatever you want to take for whatever reason, you need to take it at least a minimum of 3 months.
Yeah.
And you need to take it right, consistently, daily.
Regularly, daily.
Because the body does not reverse its chemistry with a snap of a finger. That's what drugs do. But drugs have a price to pay, as we talked about. There's a price for that instant magic.
Yeah.
Withdrawal, dependency, side effects. There's always a price. With nutrients, there's virtually no side effects and no price to pay except time.
Yeah.
And I always tell people, you got to give it at least 3 months. 6 months is better.
May is Arthritis Awareness Month.
Yeah, and arthritis affects the majority of people over 40. So let's find out why, and let's see if we can do something about it.
And why does it seem like arthritis is affecting more and more people than any other time in history? It's because there's more people?
Well, that's partly it. It's obviously there's more people to be affected. But it's lifestyle. It's nutrient deficiencies. It's protein deficiency.
Deficiency?
Yes. The connective and joint tissues, the cartilage in your joints, that's all protein, folks.
So do vegans have more of a chance then? A little?
Not necessarily, because if they're following it properly, there's plenty of vegan sources of protein.
Yeah, you're right.
It just depends on... The problem with many vegans is that they get sloppy like the rest of us.
Yeah.
And they don't eat the proper combination of things, and so they can often be protein or have other deficiencies. But that's not because they're vegan, it's because they're lazy. They're not doing it right. But there's environment. We are living in the most pro-inflammatory environment in human history.
Yeah.
We have pro-inflammatory agents from chemicals in our food, our water, the air we breathe, the environment around us.
The products we use.
Products that we use. There's so many pro-inflammatory agents surrounding us. And as a result, the majority of us at any age are living with very high levels of pro-inflammatory agents or chemicals in the body. And as we get older, but usually past 40, 45, the body begins to lose its ability to deal with abuse. And the abuse begins to take a greater and greater toll on the physical body. Arthritis is one of those. Now, arthritis can be caused by a lot of things. It can be caused by an athletic or injury or an accident of some sort that damages the joints and connective tissues. But the majority of arthritis is caused by a slow, continuous deterioration of joint and connective tissue from pro-inflammatory agents in the diet and in the environment.
And so there's all kinds of treatments, therapies, and all kinds of tons of different ways of dealing with the issues of arthritis. early or in the middle, or when some people wait till it's too late, what would you say is the best approach for natural using nutrients to try to combat if you get ahead of it, or even if you're in the middle of it?
My first and foremost is don't wait.
Yeah.
Do it ASAP. Because once you start developing osteoarthritis or inflammatory arthritis, it's not going to get better by itself.
And so stress leads to inflammation, and then inflammation is also impacted.
Yep.
Like that?
There's another, that's another thing. Stress is very pro-inflammatory.
Yeah.
What it does to your adrenal glands, what it does to your pancreas, the standard American diet with its highly refined carbohydrates cause elevated insulin to be produced, and insulin is one of the strongest pro-inflammatory hormones found in the body. So people who are on a refined carbohydrate diet, people who have diabetes, are living with even greater inflammation than many of the rest of us. But what are you going to do about this? Well, there's two natural approaches. One, first and foremost, you want to provide the body with the raw materials it needs to maintain healthy cartilage, because it's when the cartilage becomes destroyed or greatly reduced that inflammatory agents fill that space in the joint, accelerating deterioration. So we want to use a good chondroitin and glucosamine sulfate formula together with natural anti-inflammatory agents such as MSM, Boswellia, and so forth. And most recently, curcumin, which is an extract of turmeric, which is an East Indian spice. And secondly, we want to bolster natural anti-inflammatories by using a high-potency natural anti-inflammatory support supplement. So by using a joint maintaining and rebuilding supplement together with a natural anti-inflammatory, you're in the best possible position to, at the very least, halt the advancement of joint deterioration, and very possibly, if you started it early enough, to actually rebuild cartilage tissue. And there has been numerous studies to show that cartilage tissue can indeed be rebuilt if you don't wait too long. And that's the whole key when it comes to arthritis. Every day that you wait, further damage to your joints is taking place.
And so you're talking about two different formulas, hitting it from both angles, kind of, giving it nowhere to run. So that's I think a lot of people don't think of that, because I think when people think of it and they're trying to maybe get ahead of it and they're talking to their doctor about it, and they think of only the joint replenish part and not the inflammation part, or just the inflammation part and not the joint part.
Yep.
And you were talking about two key approaches. How important is ratio and potency in those two type of supplements? And I think at phoenixvitamins.com you can get the natural anti-inflammatory support and the joint support, the complete joint support. How important is ratio and effectiveness? Let's say somebody isn't going to order from Phoenix Vitamins. They're going to go and try to make it themselves or try to figure it out themselves. What's the importance of the ratio and potency in a product?
Well, again, it goes back to the old concept, if a little's good, more is better. And that's rarely the case. It isn't how much you take, it's the form in which you take it. And
like you say, you got to continue to take it 3 months, 6 months, maybe a year.
At least, yeah. You didn't get messed up joints and painful joints last week.
Yeah.
You've probably been working on it for years. You can't reverse it by Friday either. So you've got to commit to doing these things that are helpful. And first and foremost, you've got to get internal inflammation under control.
Yeah.
And once you do that, then you can start adding things like glucosamine and chondroitin, which, by the way, are very difficult for the body to absorb. So when you go to one of these discount houses and you can get a lifetime supply of glucosamine sulfate for $29.95 in a bottle so large you can hardly pick it up, buyer beware, because glucosamine and chondroitin are very difficult for the body to absorb. And that's why we have to add cofactors to that to enhance the breakdown and absorption at the cellular level.
And to enhance the absorption.
Yeah, absolutely. What you can't absorb doesn't do you any good. You're just going to pee it out.
Yeah.
You got to absorb these things.
Well, I think that's a great intro to our new way of doing it here, and really discussing, about, when you make these decisions with your doctor, whether it's about drugs or the natural approach. The natural approach is always a good place to start,